Welcome to the quick guide for InsuPen Pro. Let's take a look at the different parts of the pen and the needle. This is the pen cap which protects the pen. A cartridge holder. A pen body which has a plunger rod. A dose window with large clearly marked digits. An easy to rotate dose knob and a flat smooth injection button. Your InsuPen Pro starter kit comes with a pouch, InsuPen Pro, user guide, warranty card, BD pen needles and stickers to help differentiate the insulin that you are taking. The first step is to keep all the supplies ready. Take InsuPen Pro out of the pouch. Pull off the pen cap. Select the sticker according to the type of insulin. Peel off the sticker and paste the sticker onto the cartridge holder of InsuPen Pro. Detach the cartridge holder by twisting and pulling gently away from the pen until it clicks. Grip the pen body in one hand and gently push back the plunger rod with the other hand into the pen body. Remove the cartridge from the pack and check the label on the cartridge to be sure that you have the right type of insulin as prescribed and it has not expired. Also ensure that the cartridge is not broken. Wait till the cartridge comes to room temperature before using it. Based on appearance, there are two types of insulin: clear insulin and cloudy insulin. Clear insulin need not be mixed, while cloudy insulin must be mixed before each injection. Cloudy insulin. First, insert the cartridge into the cartridge holder by the metal end first. Twist the pen body back into the cartridge holder until it locks with a click. Roll the cartridge between your palms 10 times in a horizontal position. Then hold the cartridge upright in your hand and move it up and down 10 times by flexing your arm. Check to ensure that the insulin is uniformly white and cloudy. If not, repeat the previous two steps. Take a new pen needle. Remove the protective seal from the outer needle cap. Do not attempt to pull out the needle by hand. Screw the needle firmly onto the cartridge holder. To prevent the needle from bending or falling off, keep it firm and straight while attaching. Remove the outer needle cap and save it for later use. Carefully pull off the inner needle cap and throw it away. Droplets of insulin may be seen at the needle tip. Priming of InsuPen Pro must be done before each injection to ensure that there are no air bubbles in the cartridge and InsuPen Pro is ready to administer a dose. Hold InsuPen Pro with the needle end pointing straight up. Tap the cartridge holder gently with your finger to raise any air bubbles to the top of the insulin cartridge. There may be a few small air bubbles still seen. Turn the dose knob until you see the number 2 in the dose window. With the needle pointing upright, press the dose button in until it stops and the dose window shows 0. You will notice 2 to 3 drops of insulin coming out of the needle tip. This indicates that the priming is complete. If no insulin comes out of the needle, repeat the step up to a maximum of 5 times until 2 or 3 drops of insulin are visible at the tip. Your InsuPen Pro is now ready to use. To set the dose, turn the dose knob to set the required dosage as prescribed by your doctor. Doses with even numbers are indicated as digits and doses with odd numbers are indicated by short lines between the digits. If the number set is higher than your desired dose, then turn the knob to a lower number until the correct dose is set. Please note, after repeated injections, if the injection button stops halfway and 0 is not indicated, do not try to force the injection button down. This means the cartridge does not have enough insulin left. In such a scenario, replace the exhausted cartridge with a new one and inject any balanced dose. To administer your injection, select and inspect your injection site. The preferred areas to inject are your abdomen, thighs, and buttocks. The back of your arm may also be used. Hold the pen needle at 90 degrees to the skin surface. Press the injection button and hold the pen needle in for 10 seconds to prevent leakage. Once the needle has entered the skin surface, do not change the angle of InsuPen Pro because it could cause the needle to break or get stuck in the skin. Remove the needle from your skin and carefully place the outer needle cap over the needle. Used pen needles should not be left attached to the pen. This prevents the entry of air or other contaminants into the cartridge or the leakage of insulin from the cartridge which can affect the accuracy of subsequent doses. Unscrew the cap needle and dispose it safely. To close the pen, align and press gently to secure the pen cap to the pen body. Do not remove the cartridge from the cartridge holder until the cartridge becomes empty. Store your Insupen Pro for next use in the pen pouch at room temperature. Remember, always use a new pen needle with every injection. During repeat usage, please follow all the procedures explained earlier except the inserting of the insulin cartridge. That is, pull off the pen cap, mix cloudy insulin, fix the needle, prime your pen for injection, select your dose, inject, discard the needle, then store your pen safely at room temperature. Since insulin needs to be taken regularly, injecting in the same place can cause extra fat deposits, a medical condition known as lipohypothropy. To avoid this, you must consistently rotate your injection sites around the chosen area of your body, as well as around different parts of your body. Insupen Pro is a new, easy-to-use, reusable insulin pen that can deliver insulin from 1 to 60 units of insulin doses. Insupen Pro is only to be used with Biocon's pre-filled cartridges as prescribed by your healthcare professional. Thank you for placing your trust in Insupen Pro. Please read the user manual if you have any doubts or consult your doctor. Insupen Pro, insulin with ease.